I think it's fair to say that for most of us, when we think about orthopedic care, our minds naturally go to your knees or your hips, something to do with your legs. But the truth is, finding an orthopedist who specializes in hands is so very, very important. We are so happy this morning to have on the show Dr. Bob Mastey, who is with the Center for Sports Medicine here in town. Good to see you.
Nice being here, and thank you for having me.
When I learned of the topic you were bringing to the table this morning, I will confess I got kind of excited because this runs in my family. My mother has this, my oldest brother has this. The it is Dupuytren's disease. What is that exactly?
Well, it's a problem that affects the hands, and what it does, it causes collagen fibers, scar tissue to form in the palm leading into the fingers, and your fingers over time will contract, will start to flex, and in doing so can cause problems with using the hand. And so it's a problem in the hand. There's also it's also related to a problem in the foot called Lederhosen disease.
Huh.
And for men, it can affect their personal, their private parts, and that's called Peyronie's disease.
Huh. So does it run in families? I know that now I see commercials actually about Dupuytren's disease on TV now. When my mother first was diagnosed with it, gosh, I don't know, Dr. Mastey, 20 years ago maybe?
Yeah.
It was kind of an unknown thing, I thought, at the time.
Yeah, so what we've learned is so far is about 50% is associated with a family disease, a family origin. It's familial. It passes through generations. It may not show up in every generation, but it does pass through. So that's 50% of the cases. The other 50%, it happens without any known relative having the disease.
So when you talk about, I'll hold up my hand for a minute. I know you can't see me, so I'll try to give you a play-by-play. But when you hold up the palm of your hand, is that where the collagen is building up? Is in there, or is it actually in your fingers?
Well, if you trace from your mid-palm into each one of the fingers, that's the pathway of the disease.
Okay, so again, there are always advances happening in medicine. So here you are. This hand specialist at Center for Sports Medicine. What do you do to treat it now? Is it a surgical fix? Is it an injection fix? What do you do?
Well, it's funny you should ask that, because for many years the only treatment we did have was surgery. And then many years ago they started experimenting with an enzyme that came from a bacteria. They were able to grow that. And that enzyme actually breaks down the collagen. And so now we have available a medicine that you can inject, and that is a lot easier than going through surgery.
If you are someone, I hate to keep throwing myself into it, but I do have this personal experience, and so some of our viewers may as well. My mom, in her case, was a surgery that she had decades ago, and it quite honestly put her through a lot of physical therapy, but it didn't remedy the fix. I mean, it didn't remedy the problem. So would someone who's done the surgery be a candidate now for the injections?
Yes,
Really?
You can still do the injection for people who've had the surgery. Yes, that's the nice thing about it. And there's still a role for surgery. I'm not saying, but by far, and I've been doing this for a while, the injection is such a powerful tool at our disposal, and it has lots of benefits, and I've enjoyed using it, and have had very good success. And for the reasons of there's less risks, there's less hassles for the patient. You don't have a long rehab period. You don't have to deal with an open wound in nearly all cases. I'm not going to say in all cases, but in a good percentage of the cases that we do with the injection, we do not open up a wound. And it's just so much nicer in that way. Now, the injections may require several rounds of injection, and the injections, just like the surgery, doesn't cure the underlying problem. So it can come back years later, but the thing that we're seeing with this injection is that if we were able to break the tension and get near full or full extension of the finger, it is less likely to come back.
Really? So
Yeah.
now, um, when it comes to what this will do to you, I mean, bit by bit, your hand just kind of begins to curve in, and sometimes it can affect just a couple of your fingers and not all of them. Is that correct?
That is true. And I have here's somebody with,
Yeah.
yeah.
So, is there anything that people can do to ward this off and prevent it, or is it just in your DNA?
It, uh, there's not much you can do.
Okay.
Unfortunately, yeah. Yeah,
Well,
not much you can do.
that might actually be a good thing because we live in a world where everything is about do this to prevent this happening, and every now and then you can't.
Right.
It's nice to hear about something that just is going to hit you or not.
That is right.
Is
This
there an
something-
age where you tend to see it surface?
Well, it's rare in younger people. We start to see it in the late 50s, 60s, and 70s. That's when we start to see it. Even in the 50s, that's kind of on the young side. However, and there's always an exception, there are some people who get it early, and they have it on their hands, they have it on their feet, they have it on their private parts. For the men, have it on the private parts. And there's this family history, and they say, "Oh yes, my father had it, my uncle had it, and this long line of people who've had it in their family." That's called Dupuytren's diathesis. That is Dupuytren's on steroids, and that is such a tough situation. It doesn't happen. I don't see it often, but when it does happen, it is a very, very difficult thing to handle. In fact, I have a patient. Here's a picture of a young person with both hands, and if you can see how much that's involved, that's pretty bad. Yes.
So early intervention then is really important.
Yes. Yeah. Yes. And the whole thing is, it's got to be done at the right moment. You can't do it when it's too early, and you shouldn't wait until it's too late. And that's why you need to see a specialist to decide on how to handle that.
Okay, let's change the subject just a second because you're talking about young people, and I do want to bring this in because we had a bit of a casual conversation before. A lot of kids are going to head back to school this year virtually, which means even more screen time for them. And you said that to be watchful because kids can develop issues by typing a lot.
Yes, not necessarily. Just everyday hand use. Their hands get injured, sprains that could be passed off as just a benign injury. But those injuries that last longer than several days, 3 days, they really need to be evaluated. There's a couple of problems that, if treated early, and this goes for children as well as adults, but there are some problems that, if treated early, it can avoid a lot of hassles, secondary deformities. And two of them in particular is the mallet finger, in which the extensor tendon to the end of the finger is ripped. And when that happens, the finger at the end droops down, sort of like that. As you can see, someone's left finger.
Yeah.
That's called mallet finger. But if you get treatment early on, you can avoid a deformity in most cases, and you smooth sailing. If you tear the tendon a little bit more proximal over this joint, that's called a boutonniere deformity. Again, that if you treat it early with splinting and the appropriate treatments, you can avoid problems later on. And we see this with any type of hand use when people, quote, jam their fingers, whether they hit an object or a ball hits them, a bat, or they hit their fingers onto a hard object. One of the biggest causes that I see for mallet fingers, people cleaning carpets or something like that, scrubbing something, and their finger hits something, and then they feel it snap. And that's one of the things that we can easily treat if seen early.
So the bottom line is, don't make any assumptions and think that you've, quote, just jammed your finger. It could be more than that, and you want that expert eye taking a look at it.
Yes. Stitch in time saves 9.
Dr. Mastey, thank you so much for sharing your morning. I'll tell our viewers that, bless his heart, he was having to say, hold on a minute, he had an x-ray he had to take a look at. He's a true multitasker this morning. But thank you for taking some time with us.
Well, thank you for having me.
You can find him and many other great orthopedists right here at the Center for Sports Medicine in Chattanooga, but locations all across the viewing area. Simply call the number there on your screen or go online to sportmed.com to find the location and the orthopedist closest to you. We're back in a minute.